Hello, and thank you for joining us for this video series titled Teaching and Learning Evidence-Based Relationships, Interviews with the Experts. This project is brought to you by the Society for the Advancement of Psychotherapy, APA Division 29, and is a companion project to the third edition of Psychotherapy Relationships That Work. The overall goal of the project is to translate relationship research to teaching and learning from the classroom context to clinical supervision. My name is Dr. Raina Markin, and today we are very fortunate to be joined by Dr. Christoph Fluckiger, who is a professor of psychology at the University of Zurich, a psychotherapist, supervisor, and trainer. The topic of today's discussion is how to translate research on alliance in adult therapy to teaching and training. Thanks for joining us, Christoph.
Yeah, hello. Thank you very much for the invitation.
So I guess to start off, it would be helpful if you could just tell us how you and your colleagues define the alliance, theoretically, how you operationalize it in research.
Okay. So actually, the alliance is not a particular intervention or a very precise framework. It's actually a principle of how therapist and patient interact with each other. It's a collaborative quality within the sessions. And there is also an invitation for the client to be an active participant within treatment. And actually the alliance overall is a positive quality between therapist and patient. Mm-hmm. And there are several components. For example, it needs goal agreements and task agreements and also a certain bond, but that are just different components to explain or to understand this overall collaborative quality.
Mm-hmm, mm-hmm. Yeah, so it's really kind of at the heart, that collaboration.
Right, and you can see it quite good in DVDs when we are collaborating with the client or not.
Mm-hmm, mm-hmm.
Really a communication to each other.
Mm-hmm, mm-hmm. And so I guess given that, can you briefly tell us sort of your main findings in this recent meta-analysis that you and your colleagues did on the alliance in adult therapy?
Right. So there is actually a robust association between the alliance and outcome across assessor perspectives, alliance and outcome measures, different treatment approaches, patients' characteristics, countries. But there is also a lot of heterogeneity, but overall it's a positive association.
Mm-hmm.
Outcome. Actually, there are very, very few studies that just report a negative association. So we can say the alliance is actually not a good indicator for really negative outcomes.
Mm-hmm.
This is based on 300 studies over 30,000 clients worldwide, primarily in North America and Europe. Actually, it's probably the factor that is most commonly investigated for processing outcome, right?
And so I guess one thing that makes me think of is we have alliance. The alliance is one of, I think, the most researched relationship component that we have, right? And we have all this research suggesting that it's associated with outcome, different process variables across theoretical orientations. So, I mean, is it your experience that training programs, given that teach the alliance, that we're doing a good job in our training programs of applying the research to our training, or is there a disconnect, I guess? I mean, it's the classroom context and those individual settings like clinical supervision when you can really get into the specifics of the alliance and the complexities of it. Yeah. So I guess to kind of explore that a little bit more, I mean, what's your approach when you go to train graduate students to be competent in the alliance, when working with adults? how do you approach the training in that ideally?
So actually, I just teach them that it's not basically not a skill in the sense of that you have to do this and this and this. It's more interactive, collaborative style,
Mm-hmm.
a dyadic concept. So, and overall, we can say what's the alliance is not if I just overtake the view of the client. Yeah, for example, if we just say I have this and this goal, and then say, okay, that's good. And that would not be really a collaboration in the sense that I understand what the patient needs, what his goal is, and if I agree to this goal. Sometimes I could agree, sometimes not. So it's really a collaboration to understand what the goal needs. And it either means that I, as therapist, just say what the client has to do. And also here, this would not be a collaborative one. So it really needs both of sides.
Like
so
any, yeah.
It's a negotiation. And it's a negotiation and a long-term negotiation of the aim of therapy, and also a negotiation with these long-term aims and short-term aims. So it's really to understand the overall package.
Yeah, no, that word negotiation definitely comes to mind. And I think sometimes teaching students that even that process of negotiation in itself can be therapeutic for some people.
Absolutely. Yeah.
I think in my experience as a supervisor or, in the classroom setting, in practicum or internships, that it's understandably so, I think, easier for students to align with the part of the patient that wants to change. It's harder to help the trainee align with the part of the patient that doesn't want to change, right? And we know that there's always those parts to some degree. And I guess I was wondering if you sort of have any advice or what sort of you do in those situations with trainees.
Yeah, actually, yeah, it's first also to understand why he wouldn't change. So there are also always pros and contrasts, and actually we first also need a common understanding. And so if I don't understand why he wouldn't like to change, then I need this understanding to really be therapeutic then also.
Yeah, absolutely. So I guess when you train graduate students and trainees in the Alliance, are there readings or videos? I think you mentioned, videos or DVDs or earlier, or even websites that you use as resources?
Okay, yeah, actually, if I make the training, there are, in German-speaking countries, there are usually 16-hour trainings just for example, for the Alliance. That includes a theoretical introduction, but also some trainings, more micro trainings over 16 sessions. But this is for me quite a short-term perspective on the Alliance training, to be honest. So training is more also on the supervision level then, or intervention or peer review level, in sense that we need to get an understanding of the patient's needs. For example, based on case formulations, or also to get a theoretical understanding of what happens with the client. This would be a basic basis. This process would be a basis to just get an agreement with goals and tasks, and also to have this trust. That would be one part, and the other part would be also supervision to really get into DVDs of the trainees, but also for myself. It's extremely important to record my therapies and then to see to expose me or my therapist with other therapists, to get in contact, discuss our sessions. And then there might be question about the alliance where we just can discuss, where we also can role play if there are any micro questions and so on. Also reflections about the particular situation. And there's also, you know, on one hand, the third part, and I think this is also a really important part on the alliance, it's actually, we are interested in persons. And this means not only in the therapy room, actually, we need to understand persons. We have an interest in people. We like people, actually, also. We have to like people to get also a therapeutic. This is not only in the therapy room. So I really think it needs an eager to understand people. And of course, in the therapy room, we talk with everybody. And maybe this would be also something that we have to learn outside of, you know, of a book or a training or anything. We need to talk with people.
Right. I mean, the alliance is, it's that interpersonal connection, right? Like on an experiential level.
Right.
Yeah. Yeah.
On an experiential level, on one hand, but also on a motivation and skills to really get to talk with other people, to get the language with other people, to understand the other people in sense of language, non-verbal behaviors, and so on.
And are there any, you sort of mentioned different phases, that maybe the first phase in alliance training happens more in a group setting, in a classroom context with sort of alliance training packages, and then sort of a second phase of more intense, you know, dyadic supervision, and long-term, you know, personal and professional growth. I guess what's that?
And interest, to have this interest, this long-term interest into people, seems to me really important.
I guess it makes me think of just curiosity, right? Like,
absolutely.
Yeah, just coming back to basic curiosity into the human mind and what the person with you is struggling with.
And then to get this understanding to a professional level, in the sense of that they have goals, and maybe I have goals, and we have to then get in contact together to really get therapy trained. But first, we need this eager to like persons.
Well, I guess what that makes me think of is without sort of curiosity about someone else's, you know, mental state, and without interest and liking in them, it's hard to negotiate the alliance. I mean, it seems like maybe that is sort of the foundation of negotiating the alliance, when it doesn't come so easy, you know.
Absolutely.
So are there any specific measures of the alliance that you use in your training, either like in the classroom context, or that you encourage trainees to use with their clients in session?
Yeah, actually, there are many outcome process monitorings and alliance measures. So there are different working alliance inventory, helping, HAQ, and so there are different just alliance measures that as post-session reports that we can use. And of course, our point of view, it's the client's view that is important, but also the therapist's view, or if there are many other persons involved in therapy, these are all different alliances. So it gets quite complex about these different alliances. But of course, I also can have aligns with the supervision, and so all together with the supervisor and all together, and probably it's also, you know, a little bit atmosphere also that creates the alliance.
Yeah, I suppose that's a whole nother layer of it, is the alliance with the supervisor and the supervisee, and how that then gets transposed onto the alliance with the trainee and the client.
Just to say, so the alliance doesn't just only mean one person, therapist or patient, it really means the persons that are involved.
Yeah, that's interesting. Yeah, yeah. So I guess, what are some of the common challenges that you come across when training students on the alliance, and how do you handle that?
Right. So yeah, it's challenging also, and actually there are probably one major challenge, and especially for young therapists, and it's a little bit to deal with uncertainty within therapy. So actually also for me, we can have thousands of decisions, if we are honest, within sessions. So it's really on a micro level. We have very, very many decisions. It's a fast process, and yeah, this makes us also uncertain. And there are different probably challenges then. We can be very focused on the interventions. Just the question, do I make the correct intervention or not? And this can a little bit be difficult if we are too focused on the interventions to also understand the patient in the moment, what happens. So it's really also the perception, not only to give interventions, it's also really to have a perception of life. That would be one challenge. The second challenge could also be that we think we have to have a really precise alliance stereotype or therapist stereotype. For example, that we are always very good active listeners or something like this. And that could be then challenging we need to interrupt, for example, the clients. Of course, then to get in contact with them. And so sometimes stereotypes can be a little bit difficult, and just to discuss what's natural in me and how I can be quite liveful in therapy. And the third challenge probably is also, it is a little bit more difficult if I get a personal involvement with the client, where I really have such emotions, for example, that it gets difficult that I get therapeutic. And maybe this is a point where I also need some more personal therapy tools to reflect why this happens in therapy and so on. But overall, I would say we can make mistakes, and this is okay. So alliance means that there is an openness, and of course we can make mistakes, but the moment by moment process can also change. There are many opportunities also to just, if it may be a failure, to just have a second solution and so on.
Yeah, no, I think all of those are really important points. And, you know, one thing you said it made me think of how, you know, with alliance rupture research, I think we may do a better job with our students of helping them attend to problems in the alliance, sort of like negative feelings. But I don't know if we generally address feelings in the alliance that are too positive. You know, and when the trainee becomes too invested. So I think that's potentially an interesting training gap there.
It's actually also a little bit, alliance is a positive concept, actually.
Yeah.
It's primarily not, the goal is not that we have the rupture. Basically, it's more the goal that we have alliance, that we collaborate. So, and it's also this positive quality that is the goal. So it's not a preventive goal to prevent anything. So it's really to approach this quality of collaboration. And often it happens very often. And this is a good, positive also quality that we can estimate. And of course, maybe even this positive quality can be a corrective experiences for many clients as to experience such a positive relationship. Then maybe it's perceived as real relationship.
Yeah. And I think this, what you brought up about, helping trainees feel comfortable making mistakes, that seems to be coming up as a common theme across all of, these videos that we're doing, is just really, helping, because I think students, they're so used to trying to not make mistakes to get an A, that it's really like a shift in focus to say it's okay to make mistakes.
And this seems to me also important to highlight that intervention can be extremely important, that students together watch their DVDs without any supervisor. Have this, do not have this feeling of, oh, I get the grade or something like this. And this seems to me, just this supervision or this kind of also be in contact with other persons seems to me to get a feedback seems to be important, not only for trainees, even probably more important for long-term care.
So I guess, what do you think are some of the most important lessons for psychotherapy instructors, supervisors to take from, your most recent meta-analysis that you did on the Alliance, but, your work in general in this area? What do you think are sort of the take-home messages?
So actually, on my point of view, the Alliance is a common factor. So it's not really the very specific intervention that is focused on the Alliance. It's really, of course, we have our frameworks, cognitive therapy, and CBT or psychodynamic or anything experiential or anything else. So this is important, but it's also just to have this quite human quality to be in contact with the client. That would be one lesson, so that there are probably quite common factors within our therapies. And this is basically also, I'm a CBT supervisor, but if I talk with you, you are more psychodynamic. I think, yeah, on a very basic level, we probably, if we talk about the clients, and this is my personal experience, then we get quite fast to a common understanding.
Yeah.
In sense of the Alliance.
That there's something about the Alliance that is just essentially human, and it cuts across theoretical orientations because it's fundamentally human. Right.
So this fundamentally human issue seems to me really important. And there, I'm not connected with this. It's also a little bit the question about this, the social rules or some, and how we as therapists act. And of course, I think the research should also be focused not only on how we do have to do it precisely in this really precise manner and so on. So it's really also the question about what are the degrees of freedom here in our business. So, and I suppose for me personally, the Alliance concept, it's also really the question about to take a look on the degrees of freedom and just to look if different behaviors or different approaches can actually also be successful if such basic assumptions are just
Yeah, and how different therapists, even within the same orientation, might use different behaviors, nonverbal, or verbal, to facilitate alliances. So what do you think are the next steps? I guess the next steps in terms of the research, but also in terms of what we need to do as psychotherapy trainers.
Okay. Yeah, actually also here, I'm not a US faculty member of a US university, and I experience these discussion often as are also quite country specific.
Yeah.
Overall, I would just say it's really an interesting question about the generalizability of the concept in different countries. Also, we have a lot of research in USA and in European countries, but in Africa or in Asia, we do not really have much literature there, or we don't know the literature. So maybe there are different concepts and so on. So that would be the generalizability of the concepts would be one part important for me personally. And the other thing is also to just contrast alliances and relationship barrier aspect with other experience in treatment, for example, clarification, to have insights, or mastery, clients experience mastery, so how alliance is connected with these other corrective experiences. That would be a second step to really connect these a little bit distinct concept process research. And then as the third thing, what I think we really also need good designs, in sense, maybe even also experimental designs, where we make really precise experiments, not only contrasting, RCTs. It could be alliance focused therapy against the other that is not so alliance focused, so that this would be on a very global level. But there we have the knowledge that probably overall they would be probably quite equally effective on the mean. But it's probably more interesting also, or if it could be interesting to just put one tiny thing into the mobile of therapy and to see how this works. And then the fourth more general approach would be not only really to see how we can to investigate a very precise procedure, really also to be focused on how about flexibility, how we can implement the treatments, so that we really check the degrees of freedom in our treatments. That's just, I think, it's really important, because otherwise we get really very, very tiny, and that's wrong, that's right. We lose a little bit of focus on, and we estimate degrees of freedom within therapy. This seems to me always extremely interesting, but also important for research questions.
Yeah, those all seem like very important research questions. And I guess, what about next steps in terms of training? What do you think that sort of we should be focused on moving forward?
Yeah, actually, that's, I suppose, extremely country specific. For me personally, it seems to me important that there are tools to reflect relationship factors within therapy, independent of school or tradition. So we really need such educative tools, but it's quite country specific. And the other thing, what I think is really also to go forward with tools that are not so very expensive, in sense, to have involved always the supervisor, so that we all really also investigate tools that are where trainees together can have their tools and so on.
Well, thank you very much. I think this has been very helpful for students, for trainers, for supervisors, and we really appreciate you taking the time.
Yeah, thank you very much. I hope it was more or less understandable.
Absolutely. Thank you.